Welcome to today's show. I'm your host, Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. I'm very excited for today's topic. Today's topic is breast implant illness, and it is an issue that is commonly either not known about or not even investigated if it is known about by many doctors, but it's an issue that could be leading to all of the quote unquote crazy symptoms that your female patients are reporting, and it's hidden right under your nose. And if you've tried a bunch of things and none of it's helped, then breast implant illness may be the answer here. So, as with every call, don't do anything you hear in this call without first speaking with your primary care physician. All info is up to date at the point of this call to the best of our ability. If you're not on the call and you're hearing this in the future, go research to make sure you got all the up-to-date information you need. So let's dive in. Why would breast implants be a cause of symptoms? Why would breast implants be a cause of illness? Why would breast implants be wrecking your quality of life? Well, what you need to understand is breast implants are foreign materials, especially the silicone versions. And research for many years has shown that silicone can be an issue in the body. In 2011, a new syndrome termed Asia Autoimmune Inflammatory Syndrome was defined. And Asia stands for Autoimmune Syndrome Induced by Adjuvants. And an adjuvant is a foreign material that activates the immune system. There are adjuvants in vaccines. That's vaccine manufacturers will tell you that's the key to the vaccine working, is you have to stimulate the immune system to respond to the vaccine ingredients. So they put adjuvants in the vaccine, such as aluminum or mercury or other things, to get your immune system to respond. The problem is that adjuvants trigger immune reaction, and the immune system may respond to the adjuvants. And that could be happening in vaccines, as research has shown. That could be happening in breast implant illness. That could be happening in many different issues, because these are environmental factors or even environmental toxins that are driving chronic illness. So this study from 2013 talks about silicone as being one of the adjuvants via chronic exposure that stimulates the immune system to overreact and could be involved in driving autoimmune disease. That's 2013. If we jump forward to a 2017 study in immunological research, this study covers 200 cases of Asia syndrome following silicone implants. It's a comparative study of 30 years and review of the literature by the authors. And I think what's interesting for you to know from this study is the broad range of symptoms that someone with silicone implants could be suffering from. Fatigue is listed. Arthralgia or joint pain is listed. Myalgia, muscle pain, cognitive impairment, brain fog, right? Inflammation, severe neurologic manifestations. These are broad-ranging symptoms that may not all fit a nice diagnostic criteria box in your conventional medical office. So when they do testing and they don't necessarily find abnormalities, or they can't find a label to give it, you may end up with an antidepressant or psychological diagnosis, when in actuality it could be your breast implants. And if the doctor hasn't done a thorough history or hasn't learned about adjuvants and how silicone is an adjuvant, then you may go on suffering. So this paper, looking at 200 cases, found that when the patients with silicone breast implants had explantation, meaning they removed the implants, up to 50% of the patients experienced improvement of their complaints. And so I've seen multiple breast implant illness patients, and sometimes it's as easy as explanting and the symptoms go away. Sometimes you explant and you have an improvement in symptoms, but not completely. And that means the immune system is still involved, the immune system is still activated, and the immune system still needs to be addressed. And some people have the explantation and symptoms don't really change much at all. And again, that's because the immune system still needs to be addressed. And so these authors state at the end, despite changes in the principal constituents of silicone implants during the past 50 years, silicone remained an adjuvant that may bleed, quote unquote bleed, they say, and subsequently may be a chronic stimulus to the immune system. So these things can leak and bleed out, and when the immune system or the body sees silicone, silicone isn't supposed to be there, and so the immune system is going to respond to that. Next study, another 2017 study, and this one is titled Women with Silicone Breast Implants and Autoimmune Inflammatory Syndrome Induced by Adjuvants. Description of 3 patients and critical review of the literature. So Asia syndrome and silicone breast implants. And basically, these authors again say symptoms in these cases include joint pain, arthritis, muscle pain, sleep disturbances, appearance of autoantibodies, so evidence of autoimmunity, miscarriage, Raynaud's phenomenon, which is your fingers turning from red to white to blue, and involvement of autoimmune diseases such as scleroderma, undifferentiated connective tissue disease. And these authors say, in conclusion, earlier reports that silicone is biologically relatively inert have recently been challenged with the description of Asia syndrome. What does that mean? Well, again, historically, silicone was considered inert, meaning it didn't have an impact in the body. So you could put in implants and not expect anything bad to happen because silicone's inert. The immune system won't recognize it, nothing bad will happen. Well, again, as we're seeing, the research is saying otherwise. Silicone in the body is not inert. The immune system does recognize it, and in certain individuals responds to it and can drive autoimmune disease or result in autoimmune disease. Next study, autoimmune syndrome induced by adjuvants, or ASIA, after silicone breast augmentation surgery. This paper, what I wanted to pull out from this one is what the authors, the considerations that should be made before recommending breast augmentation or before allowing a woman to have breast augmentation. And the authors say, quote, "It might not be prudent to indicate breast augmentation with silicone implants in patients with documented autoimmune reaction to an adjuvant, an established autoimmune condition, or genetic predisposition." So we'll say that again. Women who have Asia syndrome already documented, so say maybe they responded to a vaccine or to some other adjuvant, women with an already diagnosed autoimmune condition should not get silicone implants. Or if you have a genetic predisposition to autoimmunity, you should not get silicone breast implants. That's a lot of women. And if you're a woman out there listening to this and you're considering getting breast implants, you better take a self-inventory and make sure you haven't had a previous reaction to an adjuvant, you don't have an autoimmune condition already, and take a look at your family history and see, does your mother or sister or aunt or close relatives have autoimmune disease, which could mean you're susceptible and perhaps should be a check on the side of the box that says, no, don't get the breast augmentation. In 2018, in the International Journal of Epidemiology, this study occurred, silicone breast implants and the risk of autoimmune rheumatic disorders, a real-world analysis. And what these authors wanted to do was investigate the link between silicone breast implants and autoimmune disorders. So they studied 24,651 silicone breast implant recipients, so women with silicone implants, and they compared them to 98,604 silicone breast implant free women. And they wanted to see, was there an association between the breast implants and development of autoimmunity? And what they found was yes, silicone breast implants seem to be associated with higher risk of autoimmune or rheumatic diagnosis. What were the numbers? Well, you can see here in the study, there was a hazard ratio of 1.45 for being diagnosed with at least one autoimmune or rheumatic disorder if you have silicone breast implants. What does that mean? A hazard ratio of 1.45 means you have a 45% increased risk of developing an autoimmune disease if you get silicone breast implants. Okay, or women with silicone breast implants had a 45% increased risk of developing autoimmune disease compared to women who did not have them. So the risk is real, and the strongest association, or the autoimmune diseases with the strongest association with the silicone implants, were Sjogren's syndrome, systemic sclerosis, and sarcoidosis. So if you're a woman with silicone breast implants and you have one of these diagnoses already, and if that Sjogren's, systemic sclerosis, or sarcoidosis diagnosis occurred after you've had your implants put in, then perhaps it was caused by the implants. And perhaps explantation would help with your symptoms and help decrease the immune activation. And so symptom relief may occur, and then continuing to address immune system and driving self-tolerance may help you improve even further. And then lastly, in 2019, the FDA did a study, which is a long-term outcome study, the largest study ever done so far on breast implants. And it was done on 99,993 patients. So 7 short of 100,000 patients were studied by the FDA in what's called a post-approval study. So what the FDA wanted to do was to analyze the long-term safety and efficacy outcomes of patients with breast implants. And they looked at implants from 2 manufacturers, Allergan and Mentor. And what they found was, of the 99,993 patients, silicone implants are associated with higher rates of Sjogren's syndrome, scleroderma, rheumatoid arthritis, stillbirth, and melanoma. Hear that again. Silicone breast implants increased rates, or were associated with higher rates, of Sjogren's syndrome, scleroderma, rheumatoid arthritis. All 3 of those are autoimmune diseases. Stillbirth, okay, poor birth outcomes, and then melanoma, which is skin cancer. Capsular contracture occurred in 7.2% of primary augmentations, so first-time augmentations, and 12.7% of reconstructions, so first-time reconstructions. Reconstructions after breast cancer. And capsular contracture is the most common reason for reoperation among augmentations. So, conclusions, the authors state, silicone implants are associated with an increased risk of certain rare harms, from autoimmunity to skin cancer. So again, we must ask the question, do we want to add or insert foreign material into our body? Whether we're talking about silicone breast implants or copper-based IUDs, or say pacemakers, all of these things, there's potential for immune response to them. And so when considering this, like we said from the previous study, if a woman's considering augmentation, you really have to ask yourself, have I shown response to adjuvants before? Do I have history of autoimmune disease already? Do I have strong family history or genetic susceptibility to autoimmune disease? If so, then you probably should not have the augmentation. If you're a woman that's suffering from a bunch of different symptoms, from pain to fatigue to sleep issues, and none of your doctors can help you, but you've had augmentation, perhaps you have breast implant illness, and perhaps explantation could be the answer for you, or explantation plus individualized and specific immune therapy could be the answer for you. I wanted to bring this to your attention today because this is an issue out there that is probably more common than people think, because A, most people don't know about it, B, many doctors don't know about it, and C, breast implants are very, very common, especially, for example, in the Charlotte area. Uh, there was a news story one time that said the Queen City is king of plastic surgery because per capita, Charlotte has more plastic surgery than LA. So if you're getting augmentation because you graduate from high school or you graduate for college or it's just elective, you really want to, again, consider, have I responded to adjuvants before? Do I have an autoimmune disease? Do I have family history and genetic predisposition to autoimmune disease? If so, don't electively get breast augmentation because you may develop autoimmune disease afterward. There's a lot more information on breast implant illness. There's a lot more information on autoimmune disease, on loss of self-tolerance. If this information is important or interesting to you, I've released an international best-selling book recently called The Autoimmune Answer, where I dive into the immune system, dive into autoimmunity, dive into many different autoimmune diseases and nutrition and diet and all of that, lifestyle factors that impact risk for autoimmunity, and that can also be leveraged to drive your autoimmune disease dormant and optimize your quality of life. So check that out. That's available on Amazon and an audiobook version as well. Thank you for being on today's call. I look forward to seeing you next week.